receiving medicines or while receiving medicines, there are things that we have to put in mind. So today's class or today's session will take us through the different objectives, and we see that we need to know the importance of the procedure of receiving medicines in the facility or in the hospital. Describe the checklist for receiving medicines, describe handling of discrepancies in supplies, and then describe the documents important in medicine receipts and then importance of documentation. We shall look at the key elements of receipts record and then quality of the receipt. And then we have other things that we see rejection of and return of consignment to suppliers. So let us look at introduction to medicine or receiving of medicines. Medicine should always be received by an authorized person at a health facility. There should be a clear guidelines on receiving procedures. Procedures for receiving should be outlined, and there should be standard operating procedures. Receiving is the process of inspecting, confirming, accepting shipment of drugs from a supplier, including filling and signing the necessary documents. So introduction, we are still continuing with introduction. We see that there are other terms we need to know, and that term is quarantine area. This is a holding place of all materials or medicines from receiving bay, awaiting intimation by store in charge that notifies the pharmacist or a dispenser to carry out sampling and inspection. Is a holding place. When medicines are brought, is the first place we put the medicines. For example, when we had suspects for COVID, we would quarantine them before tests or as we wait for tests to be carried out on them. The same happens with medicines. Once they are received in the facility, the first place we put them, or where we put them first, before we release them to the store, we put them in a quarantine area so that we are able to carry out sampling and then inspection of the shipments. Who is receiving medicine? Who is receiving medicine? We need to know which people are authorized, which people do we need when receiving, which personnel are required to be present when we are receiving medicine. What we need to have in the back of our mind, we don't need to have only one person receiving medicine. We need to have witnesses, and those witnesses also have their specific role in the process of receiving. So supplies should be received by more than one person within the facility, especially large consignments. If one person receives a consignment, it should be a different person from the one who ordered. The person who can receive the medicines include the medicine receiving committee. So let us see what are the people that are in the medicine receiving committee. We have the pharmacy in charge, or the personnel who has done pharmacy, can be a pharmacist or a pharmacy technician, or probably that, or designated receiving persons. Other facilities or other countries may have a designated receiving persons, so we need such a person to be present. And then we have a hospital in charge or administrator, someone who is the administrator of the hospital should be present. And then we have persons from the audit office, people who are responsible for audit. Can be the national audit, can be external audit, can be internal audit. And then administration is required to be around. And then we also require the security office to be part of the exercise, because when they are aware that we have new medicines in the facility, they are conscious of the security. They are going to be alert in case of anything, a fire outbreak. The security should be aware that we have new products in the store, and so that they guard the store jealously, so that drugs are not stolen, or they don't break into our store and they end up taking our medicines. So we have guidelines or standard operating procedures of how medicines should be received. So these are like the steps we need to follow when we are receiving the medicines. One is notify or notification of the persons in the committee on arrival of consignment. Before the consignment comes or is brought, a supplier sends information that we are bringing the consignment maybe on Monday. So it gives us a time or a specific period of time to inform these people so that when the consignment arrives, they are available. They should be present in the process of receiving. So we don't have to take people by surprise and call them that come right now, we are receiving medicine. So you communicate early, notify the persons responsible, notify the committee, let the committee be aware that we need to receive or we are going to receive. We are expecting some products, we are expecting some medicines to arrive in the facility. And then have written procedures of how you are going to place the medicines and where are you going to place them. Have procedures, written procedures have to be in place. How medicine consignments are received. What do you do first when receiving? And then what follows next? Standard checklist should also be provided. Checklist what helps you in inspecting. Offloading and checking of the local purchase orders is carried out, or checking of the different documents. Since when we look at the different documents that we looked at in procurement, we saw the LPO was one of them, and that is the local purchase order. Goods received should be inspected. Our goods that we receive have to be inspected. Any discrepancies should be documented immediately and communicated to the supplier. In case we get discrepancies, we fill what we call a discrepancy form. And a discrepancy form, we looked at it in our previous documents, and we're also going to look at it here, and we are going to look at how does it look like. Previous lecture, when we looked at the documents of procurement, we looked at what a discrepancy form is. We have documentation and signing. So there is need for us to document everything we have done, and then people have to sign to acknowledge that that specific procedure was carried out. So we see that the procedure continues. We are continuing with the guidelines. And here we are. Look at the consignment note and invoice. Check the consignment note. Count the boxes you have received in case they have delivered in boxes. Tins, cylinders in case it is the gas, oxygen, or nitrous oxide. And then physically confirm that all the boxes, tins, or bottles are unopened and are in good condition. Check whether they are unopened and they are in good condition. Cross-check the dosage form, strength, pack size, and quantity ordered match with what is required or ordered and packing list. Check the prices, check for the prices, check for quality, check for the quality, damaged products, color changes, and then poor packaging. Those are things we have to check carefully. Carefully remove broken containers if there is a leak or leakage. Remove and dispose of any supplies damaged by the leak. Sometimes the liquids can leak in case they are broken. So all those items surrounding it will also be affected by the leak. And because of that, there is need for us to dispose all of them, because the specific chemicals or active compounds and excipients that are used in this different container that got broken might affect the quality of the ones that are not broken. Someone may have tampered with it, like that is why it is leaking. Okay, so there is need to dispose that off. Then we have that check that the labels correspond with the medicines as per as the supply list, and also as far as the order. Check whether the medicines are yours for your facility, and if they are not, you return them back. Okay, check whether the quantities you had ordered for is the quantities they have brought. If not, you return back. Check whether the packing list is corresponding with what has been packed inside those different containers. We said a packing list gives us a guide on what has been packed where, and we are able to know what to check where and how. Unlabeled medicines should not be accepted since they may be dangerous. In case we have some medicines that a supplier has delivered for us, we may not receive them if they are not labeled. Okay, a label guides us a lot on what it is, on how we store it, on which active ingredient has been used, the manufacturer of the product, and then the composition of the medicines in that specific product. Always check all medicines by opening the outer package. Check vials, oral solutions for particles and color. Check tablets and then capsules. So this is what you do now in the quarantine area. You are checking out for all those. Check the expiry dates and batch numbers. Check that expiry dates are long enough to ensure that the medicines will be used at least 6 months before expiry. Drugs already expired or soon to expire cannot be consumed. Before expiration or drugs not in good condition should be returned for destruction or redistribution to other centers. In this case, a discrepancy report form is filled by the person or persons receiving medicines. Okay. So in case you find any defects, any defaults, you return it back. Okay, you fill the discrepancy form and then return, and also fill goods received in what, because the supplier, the person who will supply the medicine, will give us a delivery note that they have delivered and what they have delivered. So what affirms that we have delivered is goods received note, which we are going to send back to the supplier. So let's look at the receiving cycle. With the receiving cycle, we have a number of things in it. There is a quarantine area, and then check the documents, the different documents that we are going to look at. Sample, you sample out the different products or medicines they have delivered. Inspect the sampled medicines and then report in case of any defects. Of course, reporting even a discrepancy form is part of our report. And then if they are good, you can release them to the store. You can do many reports, not necessarily on discrepancies. You can also give a report on the quality. You can give the report on the quantity. You can give the report on a number of things. Okay, but so it is necessary to report and document what you have received, so that it's good to follow up and also be in position to know what we have. You can report the expiration, you can report the condition of the medicines or the packaging material of the medicines, and then there are a number of things you give a report on. How many people came to receive the medicine is a report. Like you are informing us of how many people were present, so that we are sure that the process was well done or well performed. And then what procedures did you use to inspect? You also put it down as a report. And then after all that is done, you release your medicines into the store. Okay, you release it into the store, a place where you keep your products. So this is how the cycle is. Quarantine area or quarantine incoming goods. The receiving department, you see that there are procedures for receiving, and then we take it to the quarantine area. After that, we are going to check for the different documents. Can be the packing list, the delivery note, inspection terms, and then discrepancy form, which we shall sign, and then it is sent back, goods received note. So those are some of the tax invoice as well. We inspect it in case it is brought. And then after that, you sample out. So in the process of sampling, we are maintaining quality assurance. We are calling out quality assurance. We are going to sample and check them, because the second one is inspect. Okay, so the packing list will direct us on what we are going to sample where, and where is it located, and how many of them are there. And then we inspection team criteria of checking the specifications, and then the correct order, usable or damaged. So you inspect for a number of things: expiry, you inspect for breakage, you inspect for damage, you inspect for the quality, you inspect for the color, you inspect for any other necessary things. After that report, a report is given to accounts, a discrepancy report is given, and then a receiving report is given. The inspection team and then there has to endorse all these different reports before the discrepancy form is taken back, because a discrepancy form guides us to know, and a goods received note guides us to know what medicines are we paying for. Okay, because which of them came in good conditions and how much do we owe the supplier. Receiving procedures are important too. These are the different importance of receiving, benefits of receiving, advantages of receiving medicines. So we see that receiving procedures are important to ensure the quality of the medicines that will be supplied to patients. Like we said, putting it in quarantine, we are making sure that the patient consumes the best, not counterfeits, not leaked, or those that have damaged, not those whose half-life has been affected through transportation, not those whose color has degraded in storage. So we ensure the quality of medicines that will be supplied to patients. And then ensure availability of medicines. It ensures that medicines are always available at all times in the facility so that we don't have days out of stock. Protect the hospital from losing financial resources due to paying for medicines that have not been received. A discrepancy form is filled to acknowledge what medicines have not been received and why we didn't receive them. And then a goods received note summarizes what are those that we received and those that were in good working conditions, and then those that were of quality. So a goods received note and discrepancy form enables us to defend ourselves on what we are paying and why we are paying for them, and what we are not paying and why we are not paying for them as well. Okay, so you find that it protects us from losing, paying for what we didn't receive, paying for what got damaged. Okay, so this is a checklist of how it can look like. You can look out for more advantages. So this is how it can look like, a checklist for receiving medicine. You see that is the delivery note or an invoice for your facility. Are the goods delivered, the ones you ordered? Like you tick yes or no, like in front there, but these are like the different particulars. And then you can tick maybe yes or no. Okay. Is the delivery note or invoice for your facility? If yes, you tick yes. Are the goods delivered for the ones you ordered? Yes or no. Are the quantities delivered those in the delivery note or those in the invoice? Is it what you asked for? Is the condition of the boxes at the time of delivery acceptable? If not acceptable, you put no. Are the goods delivered in good condition? Check the liquids for leakage, broken containers, unsealed or unusual odors and colors. Like there are some medicines or syrups or solutions that their colors are known. In case there is something unusual, you have to check the ingredients that they have used. Maybe the coloring agent was changed, but if it is all the same like the others that you've been receiving, meaning there is a problem with this specific delivery. And since, or if there is a problem with a specific delivery, there is need for you to fill a discrepancy form and reject it. Okay, is expiry, we were on something here. Is expiry long? Is it that? Is expiry date of the medicine acceptable for your facility? If it is acceptable, we can retain it. And then we have I wanted us to finish that. Documents any discrepancies and then follow up. for the supplies. That is the end. And then we have handling of received medicines. How do we handle medicines that we have already received? Because remember, we have to release them. Once medicines have been received, they should be removed from the receiving bay to the storage area. Store the good quality supplies in their proper place in the store immediately after checking them. This keeps the store tidy at all times. And then delivered medicine should have a designated place that ensures that they are stored in the most appropriate way and not affecting the working place or the workplace. Okay, this is how you are going to handle them. And then after you have received, inform the accounting department that the consignment was in order so that payment will be done. Inform doctors and nurses and the staff that medicines that have been out of stock are available again. If applicable, in case we had days out of stock, we have to inform them that we have received different consignments, a consignment, and then it caters for even those that are for the medicines out of stock. Thank you so much. I want to welcome you for the next session, but before we come to this session for documents, let us take a break. Thank you and keep tuned. Don't move away.